What is the best procedure to improve my under eye bags? I'm 30 years old. I've had under eye bags all my life, but they are becoming larger as I've aged. My mother, who I inherited my bags from, had a procedure 20 years ago that left her under eyes hollow looking. She now received filler treatments to correct the hollowed look. I would really love to eliminate these bags, but not sure if this is something that I can use filler for, or if a surgical procedure will be necessary, which I'm a little bit nervous about given my mother's experience.
Thank you for your question. You stated in your question that the under eye bags is something that you inherited from your mother and that you want a strategy on how to address the under eye bags, but you also are concerned that your mother looked hollow and now is getting fillers. So of course you're concerned about what to do so that you don't experience the same things as your mother. Well, let's begin with, of course, the diagnosis. And of course, I can't assume what type of surgery your mother had. In a patient like yourself who's 30 years old, we would perform a procedure called Transconjunctival Blepharoplasty. This is a procedure where we approach the fat pockets from the inside of the eyelids. Now, it may be possible that your mother had an external approach or a transcutaneous blepharoplasty, and it might have resulted in the eyelids pulling down a little bit. I can't assume that, but a lot of times when people have this history of knowing about a hollowed look, very often it's that. And it's actually something called eyelid retraction. So with the transconjunctival approach, we're able to avoid that by the method and technique, and this way we address the fat pockets. In addition, what we do in our practice is we use something called platelet-rich plasma, which is derived from your own blood, and this is the healing growth factors that are necessary for wound healing that will also improve skin quality. Now, as far as the quote fillers that your mother needs to deal with hollowing, you have to understand that as we get older, we lose volume. And so there isn't a single surgical procedure that is going to last forever in terms of the global aging process. So the bags that we would treat you, someone in your 30s, now will still be stable because you won't have those fat pockets again, but it doesn't stop the rest of the face from aging. So you have to think about that in that context. As you get older, volume loss occurs, and if you want to maintain a certain look, you use fillers and implants and different things appropriately. But for the time being, at this point, with the puffy bags under the eyes, I think if someone like yourself, we would perform transconjunctival lower eyelid blepharoplasty under local anesthesia with sedation, light sedation, and within our office facility, and we get most of our patients back to work in about a week. And so with new techniques and technologies emerging, I don't think you have to assume that you're going to parallel your mother's experience. So meet with doctors and learn more about your options, and certainly get into the context of the ongoing process of facial aging. If we're lucky, we get older and have these problems. That being said, I hope that was helpful. I wish you the best of luck, and thank you for your question.